There's some controversial new research that's been published by the Medical Journal of Australia that's making the claim that 1 in 5 cancers picked up in Australia are better left undiscovered. They were excessively diagnosed. And it's causing a lot of debate amongst doctors and patients, and it's worth looking into. It's such a difficult debate to have because even the concept of a harmless cancer is a bit of an oxymoron that's worth analysing. So it's really worth thinking about what a cancer actually is. The cancer is the uncontrolled growth of abnormal cells in the body. So say if I've got abnormal cells in my liver, if they're just sitting there, that's not an issue. But if they grow in an uncontrolled fashion, eventually they'll start to take the blood supply and nutrients of the normal liver cells. Those abnormal cells grow. Eventually they obliterate my liver and spread to other organs and eventually cause death. Now, how can that be harmless? Well, if we think about that definition, the uncontrolled growth of abnormal tissues, I've said nothing about how fast that growth is occurring. So in theory, it is possible to have growth that is occurring over the series of decades going on. So I might die due to a completely different cause while still having the cancer in me that never would have caused a problem. And if we use prostate cancer here as an example, that's exactly what happens. If you do an autopsy on most men who die of old age in their 70s, 80s, 90s, we find something like 40% of men have some evidence of prostate cancer, who didn't actually otherwise die of prostate cancer, but died with prostate cancer. Actually died of something else, heart disease, lung disease, strokes, or whatever else it is. So you can see how in that population, picking up that they've got some evidence of a really slow growing, no problem causing prostate cancer is something we don't want to do. It causes so much panic and sadness for the people who get the diagnosis. There's the cost in terms of dollars and cents in terms of the diagnosis and the treatment, and also just the side effects of the treatment and the testing as well that's incurred by this diagnosis that really doesn't actually help anyone. So the question is, how do we go about this? How do we fix this problem? And there's at least a couple of different approaches to it. One would be to somehow identify these cancers that are at low risk of actually causing harm. So almost kind of recategorizing what we call cancer or a dangerous cancer and not a dangerous cancer. And that's always a very difficult debate to have because where do you draw the line? And this is where there's so much debate amongst doctors of different specialties. The other approach to have is to counterintuitively stop testing for cancers. That is to say, stop testing to see if people who are otherwise at low risk of having prostate cancer actually have prostate cancer. And this is actually what's happening right now, certainly amongst general practitioners. So every week I'll get several men who will come to me and say, hey, I'm just doing the right thing, coming to get my prostate checked. And they're usually coming because of roughly a decade of advertising that's being promoted by the government and other bodies, telling them to get their prostate checked either with the finger test or the blood test. So it's always a bit of a surprise for them when I sit them down and I ask them about their risk factors. And for men who are at low risk, people say under the age of 50 or people who don't have any family history of prostate cancer, when we inform them that, hey, you actually haven't got that much to gain from getting regularly tested for prostate cancer. It's possible we'll just find a cancer that isn't going to do any harm anyway. It's also possible that the actual testing of the cancer will be what we call a false positive, that it will detect something that looks like a problem, but actually isn't a problem. That isn't a cancer at all. And the testing for prostate cancer comes with a lot of risks. The biopsy, where you actually take samples of the prostate cell to see if there's cancer or not, is incredibly invasive. It comes with its own risks of infection and impotence. And inevitably, if we're going to test everyone for prostate cancer, you're going to end up with people who don't have any problems, but because of all the invasive testing we do to see if they've got the cancer or not, end up with really debilitating side effects and adverse effects. So this is the big picture view to have when it comes to trying to stop overdiagnosis of cancers, which is, do we recategorize, see what we call a harmful versus non-harmful cancer, which is really difficult, or do we just stop testing in people in whom it's very unlikely they're actually going to benefit from a diagnosis of cancer itself? Very complicated topic and lots of controversy for the next few years on this, I'm sure.